My name is Székely and I'm a PhD and medical student at Lund University. I have done a project with the title Females have higher myocardial perfusion compared to males in patients with suspected chronic coronary syndrome, a positron emission tomography study, supervised by Henrik Engblom and Salehi at the Department of Clinical Physiology at Lund University. The diagnosis and treatment of chronic coronary syndrome is determined by the degree of coronary artery stenosis assessed by coronary angiography and the myocardial perfusion assessed by functional imaging methods. In addition to degree of coronary stenosis, myocardial perfusion might be affected by other factors such as sex and age. The aim of this study was to investigate how the degree of coronary artery stenosis, sex and age affect myocardial perfusion in patients with suspected chronic coronary syndrome. 86 patients planned for elective coronary angiography due to suspected chronic coronary syndrome were included in the study. Our patients underwent positron emission tomography at rest and during adenosine stress for perfusion and cardiac magnetic resonance to detect fibrotic tissue. Myocardial perfusion reserve was calculated by dividing perfusion at stress and rest. A perfusion at stress below 2 milliliters per minute per grams or myocardial perfusion reserve below 2 were considered pathological. The minimum perfusion was assessed per vessel territory and related to maximal degree of stenosis in the corresponding vessel. Vessel territories with fibrosis were excluded. Females had significantly higher myocardial perfusion at stress and myocardial perfusion reserve compared to males in vessel territories with non-significant coronary stenosis. Higher degree of coronary artery stenosis, above 50%, indicated lower myocardial perfusion at stress and myocardial perfusion reserve with no gender differences, as you can see in figure 1. There was no clear association between perfusion at stress and age. However, myocardial perfusion reserve showed a slight decline with increased age, as you can see in figure 2. In patients with suspected chronic coronary syndrome, male sex is associated with lower myocardial perfusion. Age does not seem to have a significant effect on myocardial perfusion. Future studies are needed to investigate to what extent sex-specific reference values for myocardial perfusion can improve management of patients with suspected chronic coronary syndrome. Thank you.